Hi everybody, Ziv Simon here. I'm the creator of Surgical Master. Welcome back. This is part 2 of this video series where I'm going to talk about a very difficult case where a patient lost 2 adjacent teeth, an upper left lateral incisor and an upper left canine, which is very tricky. If you didn't watch video 1, go back and watch it, understand a little bit of the circumstances and some of the challenges that we're seeing, and also the planning and the digital simulation we did that showed that it would be beneficial for this patient to have aesthetic crown lengthening on the right lateral and central incisor. So go back and watch video 1 if you didn't, or review it before seeing part 2. In this video I'm going to show you the actual surgery and parts of it. I'll show you some of the challenges, and I'll also show you how we combined a frenectomy and how important it is. Okay, so if you look at if you're planning to perform an aesthetic crown lengthening, you want to evaluate the site quite well. You have to have a really good plan in terms of where you want your ideal gingival margin to be. And very often I recommend a surgical guide for full arch cases, but in this case we're trying to match first of all the 2 central incisors, and we're trying to create some balance with the lateral incisor, so we don't really need a surgical guide. The other thing that I mentioned in the previous video was that once we lengthen the lateral incisor, we are likely to expose cementum dentin, basically root structure, because from what I saw using the proportion gauge, the proportions were perfect on the lateral incisor, and therefore I expected to have some root exposed. So let's see how this happens. So really the first step is to decide on the most apical extent of your incision, your first gingivectomy incision, where you resect soft tissue to match the adjacent tooth. And now we can see that by creating this gingivectomy, we're actually still on enamel, which is a really good sign. The step after that is a full thickness flap beyond the mucogingival junction to assess what is the bone underneath. And what we can see is that the bone is relatively close to the CEJ. What does that mean? That means that this patient has delayed active eruption and delayed passive eruption. That means that this patient not only has excessive soft tissue, but also has excessive bone in the vertical dimension, but also in the horizontal dimension. And both of them need to be addressed as part of this procedure. Now, you'd like to be a little bit less generous in terms of your flap reflection when it comes to the frenum, because remember, we're planning to do a frenectomy, and if you reflect a flap that is relatively elaborate in the frenum area, that may become a challenge later on, as we're going to see. So the extent of the flap is from the canine on the right all the way to the left central incisor. I try not to reflect too much into the implant site because these implants still need to be uncovered. Number 2, I don't want to jeopardize what we have there because it's already deficient to begin with. So this is very interesting to see. The bone level around the canine is actually proper. Here's the CJ. We have about between 2 and 3 millimeters of bone height. We have proper bone thickness, and that tells me that this tooth, around this tooth, nothing needs to be changed. Here's the measurement between the CJ and the bone level, and same thing for the lateral incisor. Now, even if you're seeing that the bone level is at the right height, you may be tempted just to replace the tissue back without doing anything with the bone, and that would probably be a mistake because your tissue will regenerate because you didn't address the horizontal dimension of bone, and that's what we call festooning. It's extremely critical. We go over this in the crown lengthening course.